schools is facing the dire consequences of drought in this situation. Actually, the school, I don't know whether it's named after you. I don't know whether you started it or something. You'll tell us more. But before we took the break, I promised Mheshimiwa Mweke that you'll have to tell us something about the situation on the doctors' strike.
Yes.
What really is the situation? Kenyans are dying.
Yes. It's a big misunderstanding, again, because of the push and pull between the county and the national governments. What happened with that strike is in around June or July 2013, when the counties were already in and we had governors, and the health docket was devolved. PS of Health, in charge in the Ministry of Health, signed a CBA with the doctors without reference to the counties or the governors, and gave them this CBA. So when it comes to time for the implementation of the CBAs, 90% of the doctors are employed by the counties. The doctors did not talk to their employers. They went directly to the national government, issued a strike notice, and began striking.
Because that is the person they signed a CBA with.
Correct. So the governors are wondering, we don't know, why aren't our doctors in the hospital? And we were only brought in last Monday as the Council of Governors to begin to look at this. I mean, even when the president called the doctors to State House to negotiate on that CBA, not a single governor was there. And that's where there's a breakdown in the system, because health is a devolved function. Now, when we talk about the push and pull again and people not doing what they're supposed to do, the same health ministry that devolved all these doctors and 90% of the health to the county governments retained its budget as it was, and the budget has been growing without a function. And then the counties are left with a very skinny...
It has a function. They're supposed to take care of referral hospitals,
which are 3. So 10%. So they remain with 10% of the health function. The counties get 90%. Their budgets don't change. So that money doesn't follow the function to the counties. So the counties are left stuck. Now the counties are supposed to be unique, and every county has its own issues. And I liked what Senator Elachi had said. So when the government also now goes and decides we're going to buy health equipment from all the counties the same, it's wrong. Without consultation with the counties. We're going to go and buy containers.
I remember the containers issue. Yeah.
Mobilize containers, which are now still sitting in a port in Mombasa for all the counties. That's the national government doing a county function without reference to the counties, and it brings the push and the pull. So where are we now? The doctors have now started negotiating with the governors. The governors have been brought in by the
employers
now the employers. And the counties are saying, listen, we didn't know about this CBA, so we have not even budgeted for it. So while we want to remunerate the doctors well, we don't even have the budget for it, and it would be an audit query. So I think we just now need to get to a middle ground where we sit down at the doctors and say, okay, fine, let's start from scratch. What are your requirements? Can we begin to budget for them? If it's a new CBA that will meet what you're trying to do or your aspirations, let's get it, and we find out a way to be able to implement it, so that they go back to work immediately and start taking care of citizens.
Can I mention one thing?
I'll give you a chance, Mheshimiwa. Let's welcome Senator John Lonyangapuo. Senator, your colleagues Omar Hassan and Mutula Kilonzo Jr. Had a press conference yesterday, and they said the Senate, as members of the Senate, they think they can come in and arbitrate the situation. What's your take on the doctors' strike and how it's been handled so far?
Thank you, first of all, for welcoming me here. And to say what my colleagues here have said is true. Health is mainly devolved, except policy. And policy is just books and papers and written documents that can guide the functions, which you cannot also run it from Nairobi. You get it and send it to the...
implemented on the ground.
Yeah, send it to the ground. I think desperation is setting in now. That is why our colleagues in Senate, and Senate is in charge of, to oversee protect of counties and also represent counties. Now that we have reached that level where there is things have come to a standstill for a long time in the counties.
Actually, 43rd day today.
43rd day, and it's a mess and it's a shame. It is indeed a shame that nothing is taking place. My colleagues did the right thing to call, and particularly those people in the health health committee, and all of us will participate with whatever they have agreed to call. And so it calls upon all of us to take responsibility. If you look at what is called CPA, there was no counties before then. So governors were absent. But because of the constitution of the year 2010, somehow the national government had to take responsibility for whatever was supposed to be done by counties to come. If they signed it like that, they should have now followed to give to governors and counties.
It was signed when the counties were there. It was in 2013 after the election, and every county had an elected governor.
Wait a minute.
So they were not involved.
A single governor was not.
You know, roles and responsibilities have not been known. Even now, counties are still being looked down. Anyhow, somebody signed, isn't it?
Correct.
A responsibility was undertaken, isn't it?
Yes.
And counties and national government are supposed to do they are supposed to be interrelated.
Yes.
So if the main organ signed, what is your problem? Yet the money comes through that ministry. What we should be asking ourselves is, have we now sat down to audit what was developed and what hasn't been developed? If not, we must face the truth. We call for a national conference for which all the governors will be there, the national government will be there, and sit and forget the past. There are errors that have been committed, and there's total competition between the fellows who remained in Afia House
and the people who went on
the ground. And you know, when your people are carried, I don't know whether the files were transferred also of all those doctors, or they are still stuck in Chogo.
Quite an interesting suggestion there, that there is need for a national conference where people re-evaluate these devolved functions and etc. I want to come to you, Mheshimiwa, before we move on to the next subject.
Two issues. Number one, if you want to make Kenya a better country, if you want to make Kenya prosperous, if you want to create jobs for our people, we must have a situation where we are sending more money to what we call development votes as opposed to what we call the recurrent votes. That is why we are going to create more employment for our young people. That's when we are going to have a more equitable society. But now we have a situation where, which is obtaining in Kenya, 17% of what we get is being used to
current
pay,
expenditure.
Yes, to pay a very small segment of Kenyans. So therefore you have a mass of people who are only trying probably to derive benefit out of a very small proportion that is now sent to the development.
Mheshimiwa, you have about 200 days and counting. Are we likely to see you introduce such a motion in Parliament?
Well,
because you sit where the laws are made.
Well, the point is, personally, from where I see it, I have proposed several legislations whose idea is to send more money to what we call development votes as opposed to recurrent expenditure, and I know some of them have never been taken up. Some of them I think the government is really considering them about. But and therefore my idea is anyone who is working in government, including myself, should count himself very lucky when you compare that person who does not even have what we call today doesn't know where he's going to get his daily.
Like the people in Baringo. We saw a school
anyone getting a salary from the government. We are very lucky. We are very lucky. We should always be mindful of those people. Number two, also, I wouldn't want a situation where we compromise a certain program of the government, where medicine is the only profession where government guarantees employment. Government has always had this idea of doing away with that, scrapping that program, on the argument is not sustainable. But other factors have mitigated against the scrapping of that program. I wouldn't want a situation where we have the government then gets an excuse to say, no, from now going forward, we no longer guarantee employment for our pharmacists, for our dentists, and for our medics. And therefore, as they negotiate, we must also ensure we have other young people coming from that profession, and we should not have a deal which is going now to make government get an excuse to scrap that program which guarantees employment to our graduates from our medic school.
But
Senator, I really want us to move on, because we have quite a number of issues.
When I look at the doctors and I see the nurses, that is where now I get more worried, because I know the nurses are the ones who do 80% to 90% of anything on a patient. So if you're talking, if doctors are feeling they really want that percentage, what about those who work for them throughout, even who do the work that the doctor was supposed to do?
Which is, that argument can be...
and clinical officers.
I mean, and clinical officers.
You and I know. You and I know. You and I know that teachers in preschool and nursery do the bulk of the work. But are they paid the same as
No, but that is why we are saying Sarah Serem is there, and that's why the doctors should also appreciate. We've started looking at roles, every role, and you must appreciate the nurse is the most critical person in the health system. Then the doctor comes in and just advises, and the nurses take back the whole jack.
Point made. Mheshimiwa, we were talking earlier on before you came in and found us on this doctors issue, quite controversial, people giving diverse opinions about the drought situation in the country. We saw a clip where the situation in Baringo is quite dire, and the school is called Lonyangapuo Primary. Is that your school?
It's not my school, it is a public school.
Somehow,
in the year 2008, I decided to visit my kindreds in East Pokot. You know, I come from West Pokot. East Pokot is in Baringo County. Then I decided to go and visit. It's nowadays called Tiati constituency, but as a district it's called East Pokot. I was surprised, indeed surprised, that there are no schools there. There were extremely very few schools. In a location called Silale, which is nowadays a ward, there are 2 schools. And Silale is bigger than Kiharu constituency twice. And there is no primary school. Leave alone now every other thing. That's when I decided, together with the local people, I felt the need to assist them. That's why we built a school.
So now that we have a school there and we have a situation in our hands, apparently, according to Mheshimiwa Mweke, the government has statistics that show that every 4 years, 1 year is likely to be very hard drought-wise. You have been in the government. Are there policies to help mitigate this?
So, let me complete. If you have 2 primary schools that don't reach class 5, since independence in a location, it's in their government that can get worried. What happens to those Kenyans who are in that location? You have a chief, you have several chiefs, you have a DIO, you have a DC, you have all those fellows in those days. Nowadays we have new ones called county commissioners. For national government to look at it, because the national government agenda is primary schools, secondary and above. If your people are not going to school, tell me where they are going. That's why we have a lot of cat rustling going on. Because you have to live like an animal, survival for the fittest. You have just seen, I showed what you're showing.
Oh, you saw the clip?
I saw the clip where people are now
eating wild berries.
Boiling wild berries, which takes 6 to 8 hours to boil. Because it is something that's not supposed to be eaten by man. Now, that is the scenario. I built a school. Little did I know that the people became excited over it, and they changed the name from what it was and put my name in it. So whenever people see it, they thought maybe it's an academy. That's a luxury there. Nobody even knows what you mean by
a primary school.
An academy. This is a disaster at hand. Whether we have policies, yes. We inherited policies in 1963. Those days, the colonial government decided to put dams, surface dams and major dams in areas where pastoralists are. Then instead of going on to build more, we never did up to now. What we have concentrated in some NGOs and the government, and now these new ones called counties, is digging boreholes. Boreholes are the first casualties. They dry very fast as soon as drought arrives. So what do we want? We need major dams. You spend 10 million, 20 million, 30 million. I wish the one people are fighting in Muranga, your own county.
By the way,
I am told you have, people are saying we don't need it. Please take it to Baringo. We need those dams there, need them in Turkana. Because when it rains, we have major floods, but they run all the way to Lake Turkana. If we are able to tap that water, what we see here, where people are fighting over water and over grass, is even easier to have an animal drinking water and lacking grass. Okay? Then you'll have peace with your neighbors. That's why we have a lot of problem around Pokot Tuken, because Pokots, they are little animals that they love most, and that's what they eat. They have to go and look for water and grass. And then the neighbors think they have been invaded.
So they fight
Some
back.
people have come, and they are sometimes not talking because there's no Swahili and English in the mouth. Because where is the school to go and
learn English and Swahili?
Your tongue? So this is the complex. When you tell the people Nairobi Mweke,
Which is
they will not understand.
No,
They cannot. Look at the
In
way.
2000, CDF came in, and when the leaders from the pastoralist area sit and face and say...
Actually, 2003.
And three. CDF was there. I know he was a PS at that time, so...
And he went and
who are
started
there, who are leaders, really? I mean, it's unfortunate.
Irungu, you are saying something
no.
now.
At that time...
But we have seen situations. We have seen situations where a member of parliament built a whole school.
Do you think it is money? You think money is the one that changes everything?
No.
I think
it's
you.
the planning.
Yes.
It's the planning.
It's
It's the
not
planning.
the
The leader. What is the priority in that area?
No.
You made your point. Which one?
No, it is true that we can have some interventions of CDF which are positive. That one I concede, because I say that, like, in my place I know of a certain ward which never had water at all, and as we speak we have a drought, and I know we sank one borehole. In fact, I never thought that that borehole is going to yield anything, only for it to yield a lot of water. And even now, during the time of this drought, it is still functioning. So I believe borehole intervention can mitigate some of the problems that we are having. Number two, probably also to comment on his assertion of the Muranga Dam. Yesterday, I was in Takaine region. I was doing my campaign in that region. And I noted...
No wonder you look so beaten.
Yes, because it's quite an extensive region of Gatanga region. One thing I noted, number one, that so-called dam does not help our people at all. It does not help our people. In fact, the villages which are joined that place, they do not even have tap to water. It's a huge facility, and by the way, I would love you people, you go to that region. People don't benefit from that facility at all. So we don't even mind if we were to take the entire facility to another region. And number two, I noted that in our region, particularly the Muranga County, it's a place of valleys. And where we have two valleys intersecting, there is usually a river. I was surprised to note that those rivers have dried up. They have dried up completely. So therefore, I strongly believe, God willing, if I win that seat, I'm going to lead my people in a serious demonstration to demand Nairobians to compensate the people of Muranga. They've been taking away our water without even giving us even 1 single cent.
Let me just respond to that for a second, because
that's quite interesting.
No, I promise them. I promise them. No.
Really?
Look here. The water bill came before the National Assembly. I made a proposal to change some of the provision in there so that the so-called host counties
benefit from this.
Benefit from that. That proposal did not go through.
Here you are.
Yes,
criticizing a project by a government you are serving.
When that bill escalated to Senate, I have written documents. I did a petition to Senate. For another bad reason, the Senate did not take up my proposal. Meaning, I now have done what I can do as a member of parliament.
So you want to go to the Senate?
I'm going to do the second attempt in case I win that seat. But I want to assure you, if I win that seat, we are going to close up Dakaine. Unless you give us money, you Nairobi.
Now,
Deputy Governor, Nairobi is not going to have water.
It's not even Nairobi not having water. It's my friend
You need
Irungu.
to pay the people of Muranga. That's what he says.
It's my friend Irungu not understanding issues. All that land that Dakaine sits on and around is owned by Nairobi. You can go buy land in another county, can't you?
You bought from who?
Can't you? Can you?
Yes,
you can.
So Nairobi Water went and bought that land, put up a dam, and that's what serves Nairobi. Now when he's saying he moved that dam away, what he's saying is, around that Dakaine area, there's 6 or 7 primary schools where children go to school for free by Nairobi Water. There's over 10 million trees planted by Nairobi Water. There's a high performance athletic track.
No, education is free.
Hold on
a
second.
Education is free.
How would you want to be compensated? You'll tell us after I finish.
Please let me just help him learn.
Go on.
Yeah, you know God gave you 2 ears and 1 mouth, so you listen twice as much as you speak. So that was with a light note. Yeah. So there's several hospitals that are staffed and paid by Nairobi Water for your area. So you can't just say that let's pick up our dam and leave. All these constituents of yours who rely on that ecosystem of Ndakaine, there's over 2,000 security officers that are from your constituency in Murang'a that are paid by Nairobi Water to protect that dam. So it's job employment. So there's a lot of benefits that Murang'a people get from that. So you just can't wake up one day and say a blanket thing and say all of you must wake up and leave and take that dam somewhere else or we'll shut it. If you do that, the people who will suffer first most
are the people around there.
Are the people from Murang'a.
So is it a case of just inadequate compensation or no compensation? From what he has alluded.
At all.
Are 2,000 guys employed to take care of security?
No.
Are there schools and hospitals?
No, I can tell you without battling my eyelid that indeed those people are not locals, but anyway, they are humans. I agree. They are Kenyans, so therefore they deserve employment.
We have a kind of marathon every year to help Murang'a people.
No.
People.
What do you do?
Let's get a different view. I'll come to you, Senator.
Maybe Mheshimiwa, you need to
and now that you're coming to Dagoretti North,
as you think of all that, as I'm coming to Dagoretti North, one of the things that I know, and it's important to sit down and discuss, and I don't think Nairobi has ever refused that. That is why it is a project where they do interrelation with your county and Nairobi County. But having said that also, if we start looking at natural resources that way, I mean, even God is just wondering with us.
This belongs to us.
That does not belong to you. It
no, Masai Mara. Masai Mara benefits the Masai.
Wait.
Masai Mara.
Wait, Kangata. First of all, it belongs to all Kenyans, even Masai Mara. Because in the end of the day, the GDP that we collect will still go to Murang'a, the one that comes from Nairobi. So if today Nairobi we decide 45% comes from Nairobi, pay us, what will you say? So everyone who comes to Nairobi is also from Murang'a. Everyone who goes to Murang'a lives in Nairobi. So the water is still for everyone.
So we are interrelated.
In Nairobi, you cannot come and tell Nairobians who you are part of that Nairobian. Right now you're in Nairobi, you'll use the facility.
Come to think of it, are you using that water here in Nairobi?
If we put a toll station
on
one of the highways and you say now Nairobi, start charging who are coming in.
The question is, number one.
Those are some of the things.
You made your point.
One, Masai Mara is a natural resource, but the county of Narok benefits a lot from that resource.
And so Kenya also.
And the benefit goes to the nation.
I agree. If at all Narok County has benefited from that resource, surely even us there, we are supposed to benefit. Number two, there are things that you expect us to give back to that, to ensure that thing is sustainable.
Conserve the environment.
Yes, for instance, you want us, we people of Murang'a, to conserve the environment. You want us not to trespass into that facility. There are things you expect us to do for you. And therefore, for us not to do that which we should not do, you need to pay us.
And Senator Lonyangapuo, people from Murang'a and more are beneficiaries.
Senator Lonyangapuo, okay, gentlemen, 1 minute.
Those people who sell drugs are
1 minute. Senator Lonyangapuo has been a silent listener to this conversation.
And these people must learn to be silent also. I can see they want to lose us.
They're distracting us.
Yeah, they're distracting. They want to concentrate on Dangaini. What is happening, my colleagues?
We're actually talking about the drought situation.
Yes, but the people of Nairobi are still drinking water from Dangaini, isn't it?
Yeah.
Let's not lose a point he has raised. Very key. Dangaini was built many years ago, before devolution came. But just because you did that those days doesn't mean that you forget your responsibility. As follows: the people of Murang'a have continued to grow in numbers, and their needs have also continued to grow in numbers, and they see a big facility here that would have benefited them. How much metric tons of water do you sell per month from Dangaini? Translating how much money per month? Those of us who stay in Nairobi, how much do we now pay? This is what he's saying, and we are going to demand that it's done everywhere in the whole republic. A little bit of what you are selling, a little bit of the money that you have got it, is it 10%, 5%, 2%, or even 20%? forget about your previous obligation, which were done. That was very good. But remember, those days force was being used, isn't it? Now we need them to get that water through their county. Then they will now sit to say more of this money that has come. A major percentage must go to the villages that surround that facility. So that's what you are saying. It should happen everywhere, and that's why even the Maasais are happy, because what they collect from the Maasai Mara, more of it goes
benefits
to the
them directly.
And I was a principal in the university, and most of the Maasai kids coming to university, more university,
school
were being paid fully free by
Kenya Wildlife Service.
By the county government. So in short, it was towards the county council. In short, we need facilities, and let's pay attention to what's happening now. I'm asking in a nutshell, how many dams have the government done now in mitigating future droughts across the country? If you hear what has been happening, it has been Muranga. People are fighting over it because it is now going to interfere with the whole ecosystem. I hear there's one in Kericho. People are fighting over around the Mau area. Why are we going to those places where people have a lot of water? Let's go and tap this water rushing to the ocean and to the lakes and so on for the people that have always been in the dry area. And whether we like it or not, this government, every government must come with an initiative quickly. Like now they are going to feed people. Which people? People should have been feeding themselves. I saw Gimjuri saying, now sell these animals because they are... How do you sell things that are about to die to government?
Okay, well said. We are taking another commercial break. Remember, this is the first day of voter registration countrywide, an exercise that will be taking another 30 days. And we as a station and as a show are taking it very seriously. It's important that you exercise your democratic right. When we come back, among other issues, we'll be talking about the vigor, the vitality, the aggression, the coercion, and the buoyancy around the voter registration exercise. Will we be meeting the target? My panelists, Mheshimiwa Irungu Kang'ata, Mheshimiwa Jonathan Mweke, Mheshimiwa Beatrice Elachi, and Mheshimiwa John Lonyangapuo, shortly.